prevention and intervention versus reaction, which is what we typically see, and how to address really all of these strategies and bridge that gap between finance and human resources for more efficient, effective management and being able to demonstrate return on investment. So I put together a few slides that basically overview why we have a need for these directed strategies. So one of the big challenges that we see in the industry is time allocation. Almost 17% of human resource professionals are addressing poorly performing employees. An astronomical amount of time is spent on HR professionals on administration and paperwork alone. But on the flip side, nearly 40% of the CEOs think that HR is prepared for a transformative change, that they're prepared for this. Now, again, on the flip side, less than 11% of employers are using analytics to predict future outcomes, which is really an astounding low number. We see analytics and metrics, kind of flung around all over the place these days. But as an employer, are you really using those analytics to predict future outcomes, to put in place prevention and intervention strategies, or are you really just using them as a reactionary measure? And if you can pull all of your human capital information, all your human capital data into one system, you're going to improve your efficiency by 32% or even more. So I think one of the most compelling questions that we have from some of these statistics and time allocation is, as an executive, as a leader, are you pushing issues down to management that they cannot handle? So some other statistics here. Even though we have these industry challenges, that leads us to opportunities for growth and progress. So, kind of like one of the statistics we saw on the previous slide, nearly all CEOs recognize the need to change human capital strategies. They're understanding that it is a big cost. They're understanding that they need to identify high risk, but also high performing employees. They need to reduce turnover. They need to reduce, some of those management allocation styles that we saw, in the previous slide from HR. 80% of CEOs, CFOs, and chief human resource officers say their relationship has become more collaborative in the last few years, which is great. I think that the upper level executives are seeing a need for chief human resource officers, VPs of HR, those types of positions, take on more of a strategic role within the organization. So if we can get that to happen, 41% of those employees, they're going to experience a 10% plus growth in EBITDA. And more than 43% of that 80% have seen a significant improvement in workforce engagement and productivity when they're really kind of melding those relationships together. So this slide really just demonstrates, some of the things that, particularly that I'm hearing today. So this is what executives are saying. What we don't know is this various thing. When you look at the reports that are sent up the chain, how do you know what data is used to compile those reports? Was it cherry-picked? Was it hand-picked? If it comes from a broker or a TPA or a consultant and it goes through several different levels within the organization before it gets to you, how do you know you're really seeing what you need to be seeing? We also hear that, we need help identifying those poor performing but also high performing employees. And once we do ID some of these things that we need, how do we take these risks and turn it into actionable strategies? One of the other things we hear is, tell us what we're observing. What does this data suggest? What does this data say? What strategy do we need to put in place based on this data? And then one of the biggest things, especially that we're hearing from, CFOs, is how do we quantify outcomes and return on program investment? And can it be done? And the answer is absolutely yes, it can. But one of the biggest things, and this really kind of goes to what this presentation lends to, is we hear all the time we are understaffed. We just don't have the capacity. We don't have the time, the resources, the budget. So there are many things that you can implement to overcome these needs. One is utilizing predictive analytics, which is paramount to understanding many key metrics: human capital management, return on investment, performance standards, population health, culture, healthcare. But one of the great things that we're finding employers are more and more doing today is outsourcing some key healthcare executives or consultants or project management specialists to bring something to the table that really you might not have, again, the capacity, time, resources, or budget to bring in-house. So this next slide really just, kind of kicks us off when we talk about, what we really need to do is pinpoint the root cause and key drivers of healthcare spend. And this is obviously some of the reasons why. The majority of healthcare costs are avoidable. A very small percentage of the population is going to drive the majority of next year's cost. And what's more, nearly half of chronics, or people with chronic conditions, and oftentimes we're seeing multiple chronic conditions, they're not receiving recommended care. So this slide is actually, one of the most powerful slides that it's one of my favorites that I can kind of talk to, because it really shows, when we saw on the previous slide that a very small percentage is attributing to the majority of your healthcare spend and the majority of your increase in healthcare spend the next year. This graphic really kind of brings it to light. So you can see, from this graphic alone, 5% of your population is going to account for nearly 60% of your healthcare cost. So, when we go and we look at the per member per month cost of a healthy, and this is based on single rather than family cost, when we look at a healthy individual costing, a little over $80 per month, but somebody in crisis and struggling costing between $2,000 and $8,500 per member per month, from those top 60% of your chronics, it's really astounding. So this really shows how powerful healthcare is. When we look at healthcare spend, this really illustrates the need for cost containment. So you not only have to manage that very small sliver at the top, that 1% contributing to a ton of your healthcare spend, 5% contributing to it, you have to make sure that those at the bottom don't move up the pyramid. And you can use analytics to identify those with the potential to move up into the high risk areas. You're always going to have those catastrophic claims at the top that are not manageable. Your cancers, your premature births, your renal failures. They just have to run their course. But what subset could have been prevented or can be prevented moving forward? Preventable chronic conditions can be managed and they can be mitigated. So imagine how you can impact your bottom line if you're controlling cost on not only that top 5% of your population, but also the ones in the middle in keeping those, typical and at risk from moving up into the pyramid. What we're finding also today too, that many physicians and providers, they're doing a great job at what we call managing diseases. But you can actually turn the table on this type of medical providing and actually control cost and talk about, managing health and managing risk. And we're going to talk about that in a minute. So now we know the importance of pinpointing healthcare spend and how important that is in addressing your bottom lines. So how do we put together actionable insights that are really going to drive the greatest change? Well, what you want to do is you want to make sure that you're in the best position to leverage all the data available to you. Quality improvement, it's about understanding your population. So ask yourself, what am I trying to fix? What impact will this have on my population? What does success look like? How will we know that we've achieved it? Well, success depends on applying best practices to real world situations. Kind of I had mentioned before, there's no shortage of data and analytics floating around out there. But what we really must do is we must go beyond, pushing a button to produce a form report, because every single organization is different, and there are going to be different demographics within an organization. Every executive is going to want to see reports that are geared more towards specific outcomes. Different HR professionals, benefits professionals, human capital professionals, they're going to want to see different key metrics in terms of success. So we have to really analyze the data and understand the risk that's attached to that red flag being thrown up. We have to identify issues and patterns that drive that cost and then formulate prevention practices to mitigate that risk and then reverse the cost trend. So this is kind of, looking towards the past, looking at that historical data, but we also must look at the present and the future. So predictive analytics, they're really only powerful when you can demonstrate evidence-based gaps in care and then adjust for risk and predict. So that's where those actionable insights come in play, actionable insights that you can implement now and in the future. So, again, think back to the last time that you were delivered a report. How recent was the data used to compile it? Was it real time? Did it lag a quarter? Did it lag 6 months? Did it lag, nearly a year? If you're not looking at the past, the present, and to the future, how successful will your quality improvement plan and risk management strategy be? And unfortunately, what we're finding today is most brokers, TPAs, consultants, et cetera, they're using old data without the predictive factor. So when they provide that old data to your executives, that's the data used to compile reports and updates to you. So you want to make sure that when you're getting those very important reports, that you're getting data in real time, or as real time as you can get it. But this is also very powerful. Just one thing that you want to remember, that data is not the goal. It's the starting point. So that's where we're getting to actionable insights that are really going to drive these changes. And this is really just a great graphic that helps you understand this. So one of the things that I feel is the very best measure of a company overall is its workforce productivity. If we're maximizing productivity, we're improving quality. Any executive that takes responsibility for improving overall company workforce productivity and quality, they're an invaluable asset to ownership. So again, here we see that the focus is on risk adjustment. It's on predicting and intervening to adjust for risk. And in mitigating this, we can control cost and improve quality. So a lot of executives, a lot of owners, a lot of presidents, board members, they fail to see that all of this data that we can pull together from a human capital standpoint can be pulled together into one system. It can be analyzed by one person or a team of people with a particular skill set, and it all can be pulled together into a holistic strategy. And if you're doing that, then you're providing the most effective, the most efficient, actionable insights. And when I talk about, looking at the data, analyzing the data, understanding the flags that the data is throwing up, this is a great quote that I like to use. It really kind of goes back to, having that person or that team with a particular skill set that can, look at the data. So few people can do math, even fewer can make that math tell a story, but those that can do both, or if you can put together and lead a team that can do both, those are the ones that are really going to save an organization millions of dollars. So one of the other things that we were going to really take a dive into today is how employers, why the importance, number one, but how employers can have a mutually beneficial relationship between their vendors and consultants, and really what that means. So there's no shortage of vendors and other providers in the market. We talked a little bit on the slide, the pyramid slide, about medical waste, and some of the things happening with providers and medical practitioners these days. So how do you know when you bring a solution to the table that will guarantee results, that'll guarantee quantifiable savings? And one of the ways that you can do that is transparency. Transparency through performance strategies, performance pay, or we're hearing the term value-based pay these days. Many providers are offering this type of service today. But again, how do we know that they're doing what they say they're doing? By reading the reports that they're providing to you. Again, it kind of goes back to how old is the data used to compile those reports? Are you seeing the whole picture or only the pieces that they want you to see? There are ways to best understand the nature of risk and the best way to manage, but also provide complete transparency of solutions vendors and providers say they can provide. And this slide just really kind of lends to that, that transparency and the importance of that transparency. So advanced or predictive analytics will help you assess utilization, total cost of care, and provider performance in ways other platforms and vendors just can't. It's not easy to collect all the data required for a holistic healthcare strategy or a holistic human capital strategy. And then you have to consider that every data source has to be managed and maintained by separate people, separate departments, separate vendors, and according to different rules, different compliance. So relying on partners and vendors, consultants to provide accurate reports in regards to their specific performance and assured savings, it can be disparate and definitely costly. And this is, kind of like one of the quotes that I started using a long time ago, and it really, kind of hits home when you say this. If you're letting your vendors and partners and consultants, particularly if they're doing performance-based or value-based, if they're providing you with their own reports without transparency, then it's really akin to letting students grade their own tests. So now one of the other things that we were going to address in this presentation is really, the true consumer. We see this a lot with both employers, brokers, TPAs, benefit consultants, and they talk about, having a true consumer-driven health plan. But when you really get down to kind of the meat of it, what does that mean? Well, we put in place a high deductible. So that might be great. That might be a good piece of it. That might be, a good strategy or a feature of a good strategy. But really helping employees become true consumers of their own healthcare, it really takes a lot more than just implementing a high deductible plan or a health savings account or a health retirement account or something like that. And these statistics really kind of lend to this. Most employees, they want better benefits. Most will leave for better benefits. And we're more, in a employee-driven kind of culture like in that right now, in an employee-driven environment, and so many millennials entering the market, and half of them think that they have to leave their current job to advance their career. And this is kind of why, 7 out of 10 companies, they're increasing their budget for employee benefits, but 8 out of 10 say that lower benefits cost is a top priority. And the top 3 priorities for employees, it's compensation, benefits, and development. So, again, they obviously want compensation, they want good benefits, but they also want that benefit, that development in there as well as part of their benefit strategy. And here we can kind of, compare some of the traditional benefits that are employer driven and some of the consumer centric benefits are ones that are employee driven. And some of the ways that, moving from an employer driven benefit plan to employee driven benefit plan can very, very, very much help your employees become a true consumer of their healthcare. So if you have, an employer driven plan, over half of those employees rate their benefits as fair or poor. 28% rate their benefits education as fair or poor. You would be amazed at, we'll do surveys on both employers, like C-level executives, HR professionals, and then with the employees, and then also with the broker or the TPA, and ask them, how much do you understand, how much do you like the benefits that you're offered, and how much do you understand them? And it's really interesting to see the survey results, across the board, because we see more and more, employers are spending a lot of money on, Cadillac programs or, platinum programs. And it's really just, they're spending a lot of money on something that the employees don't really want, or something that they don't even know that they have access to, or they're not getting that education on how to use it properly. But if we can pull it into an employee-driven health plan, nearly all employees are satisfied with what they have chosen in their customized benefit package a year later. And most of them better understand then what their benefits cover. And here's some more statistics that kind of lead, credence to, why you want an employee-driven health plan, why that, really promotes a true consumer of healthcare. Nearly all employees, they want to choose their benefits package. If they can do that, 72% of them are more likely to stay with their employer. 77% of them value their benefits more, and over 80% value their employer's contribution more. So kind of like what I said, we see oftentimes employers providing very expensive benefits packages, but if it's something that an employee doesn't want to see or doesn't want or doesn't understand, then they're not going to value that employer's contribution. So the true consumer, if we can get an employee-driven plan, 83% of those employees are now more aware of the cost of medical care and engaged in healthcare decisions. So very, very, very impactful in terms of a true consumer. So how do we get there? It's actually really very simple. It's comprised of 3 different features: personalization, simplicity, and choice. So, we personalize their benefits offerings. They have money to shop for what they want for. Again, we're pulling in the data too. So we're leveraging data for decision making. And then we're also measuring success at the bottom of that funnel. So, as we personalize these benefits plans, we're tracking the success of it to make sure that it really works for not just the employee, but the employer as well. And simple, we live in a digital age, so simple is always better. But they want help in choosing the right products. There's so many products on the market these days. They want help in choosing the right one for them and their family. So that's going to take a collaborative effort. We very rarely see a broker, a TPA, or some consultant agency that really can provide everything that is needed in terms of a benefits package or benefits offering. And so when you have individual stakeholders, you want to make sure that they have a collaborative effort. So they're coming to the workforce, as a team, as a whole. We also find too that a lot of times, brokers and consultants and TPAs, they forget that, the company is their employer. They work for them. So they need to come to the table in a team effort rather than, what we typically see in those type A personalities. And then the employees, they want a well-structured decision support and education system. So again, they want education on, once they've chose the right products, they want education on how to use them. And then again, choice. So they want a broad choice of health and ancillary products. Creativity and imagination, the sky is really the limit in terms of benefits offerings. I mean, we're seeing everything these days. Student loan repayment is becoming very big, but different types of health plans. We're also seeing complementary and alternative medicine being big in terms of a carve out, but we're seeing childcare and wellness concierge and healthcare concierge and even maternity concierge. Flex time is always big. So, again, we can be as creative as we need to in terms of the choices that we want to provide those employees, but then it goes back to, really understand what drives them, what's going to make them a true consumer and what's going to make them really love their benefits offerings, understand their benefits offerings and stick with their employer because of that. So one of the other key features that we're going to talk about in this presentation is the importance of prevention and intervention versus reaction. So we've talked enough now about, I think, using old data or not using real-time data or not having access to the complete reports, transparency, control, all of that is very reactionary for the employer. But if we can flip that into prevention and intervention, then we harness the power of predictive analytics and we develop those data-driven intervention strategies, and then ultimately you're going to control costs such as these. So we talked a little bit about medical waste. An astronomical amount is being spent on fraud, waste, and abuse, healthcare inefficiencies, productivity losses. We see this time and time again where an employee is seeing multiple healthcare providers, multiple primary care physicians. They're getting the same prescription filled at different pharmacies. Brokers, TPAs, those systems are supposed to catch that. Oftentimes we're seeing more and more that they're not. And then what's more, when we start looking at these costs and issues associated with risk and injury prevention and workers' comp, these numbers exponentially increase. So this really kind of goes back to the importance of a holistic human capital strategy. When we're talking about healthcare, it's really not just about healthcare. We look at an obese employee and we look at, the health claims and the provider access and the prescriptions and ER utilization and everything that's attributable to that chronic condition. And then we look at it, on the flip side from a work comp or, risk management strategy. They're going to file twice the number of claims, incur 7 times higher medical costs. They're going to miss 2 more weeks of work than somebody with a healthy BMI. And this has dramatically increased. And we see this, more and more where departments within organizations, the professionals that are handling the healthcare and the benefits, they're not even talking with those that are handling workers' comp, disability, or risk management. And it's not just about obesity. It's, number one indicator of other emerging or chronic conditions. But we're also looking at lipid abnormality, diabetics, hypertensions. By pulling all of this data together, we give you power because ultimately workers' comp and disability claims, they directly impact the health of your population. They directly impact the success of any preventative health and wellness efforts in place. They directly impact your health plan costs. So again, most employers are failing to look holistically at these issues, which again, it can be very disparate and very costly. So if we can overcome this, then here, a more positive slide on how prevention and intervention can really help employers. reverse those healthcare and safety trends and abolish those industry standards. So we're seeing by integrating big data and predictive analytics, an employer is saving basically $1,000 per year for every belly button on the plan. They're saving $2,000 a year for every employee. And the anticipated increases in healthcare premiums and cost, if you implement big data and analytics, that's going to be cut by more than half. So in order to assess the more complex issues in healthcare space and human capital space and how it relates to human capital and the performance of the organization, it's really necessary to pull all these data sets together into a robust, one robust data set that really represents a holistic picture of an employee. So not only do you have access to data and analytics, unlimited reports, but an unbiased third set of eyes with a particular skill set that, kind of going back to that original slide, it helps you translate what can be indecipherable information. We see organizations, unless they have a big budget and the resources to, pull in data analysts, they're really kind of failing to see the whole picture in the story that math is telling us. And then also because of HIPAA, there are many things that employers cannot see about their employees. So if you bring in a third party, if you bring in an unbiased third set of eyes, then they can really dig down into some of those root causes of healthcare spend in ways that employers just absolutely can't. And then another benefit is, the burden is taken off your shoulders. So now you have time and resources available to focus on objectives of your organization and actually managing human capital rather than, addressing chronic conditions and addressing all of those issues that we talked about at the very beginning. So now we're going to look at the solution. Again, a third set of eyes, an unbiased view, a third party, an outsider. If you bring someone like that in or a team like that in that, again, can understand the math, can understand the story that the math is telling, be able to provide you with unlimited reports from all different vendors in a value-based ecosystem that all, shares this holistic strategy, all this holistic data, provides you with transparency and control in terms of reports that you're getting, then, you're able to effectively bridge the gap between finance and human resources. So the result is a more efficient management practice, and you can accurately demonstrate quantifiable return on investment, not just financially, but also in human terms, going back to, identifying high performing employees, identifying a true consumer and promoting true consumerism. So, just kind of think, in terms of your organization, what tools are you using to determine human capital and healthcare profitability? So here's a great solution. It's an outsourced human capital or healthcare executive. Somebody that can come in that's charged by top management with the mission of designing the workplace for optimal health, optimal well-being, productivity of the company's, it's your most valuable asset. It's your employees. Again, most employers are their top like 1, 2, 3 category of spend, goes to healthcare, goes to the benefits. So you want to make sure that you're doing it right. You want to make sure that you have, those resources, again, the transparency, the control to bring in the tools to really understand the profitability of your human capital. So when you do that, you want to bring in somebody with the skill capable of producing sound predictive models, and that's really going to be the key. You want to be able to bring in somebody that can form a hypothesis, can oversee and manage rigorous testing with sound statistical techniques, have a thorough understanding of data. I mean, there are a lot of things to understand when we talk about data: strengths, weaknesses, inclusions, exclusions. Again, are we getting a holistic picture of all of the different metrics, of all of the different data feeds from all of the different pieces of human capital? So not just your medical and pharmacy plans, but also work comp, disability. When we look at culture, we're uploading everything that we can about your population in terms of, productivity metrics that you might have in place, demographics, geographics, all of this stuff comes into play. Are you doing surveys on your culture, different things like that. So we want to look at data sets from as many different variables as possible, and then integrate that data. So data integration, normalization, governance. You also want somebody with exceptional strategic techniques that involve that data, but also policy, prevention, again, culture, organizational objectives to quantify success. You want someone who can quantify that human capital return on investment. And then finally, leadership and direction of impactful employer-facing multi-objective human capital and healthcare solutions. So again, by doing this, you're going to be able to dramatically impact bottom lines and overall employer and employee well-being. And this is another great quote that I like. True experts, they don't possess knowledge, they explore and they share knowledge. So, by bringing in a third party, an unbiased set of eyes, one of the great things that you're able to do is you're able to avoid the politics that typically come with organizational objectives and bumping up in positions, bumping down in positions, managerial techniques and styles and supervisory techniques and styles. And you're really kind of able to eliminate that. And as an executive, bring that control, that transparency, really kind of like that third set of eyes that isn't involved in the day-to-day, politics of an organization, bring it to the table. So this is a great graphic because this is something that, we often see. Organizational objectives, they have a tendency to get lost as they move down through the organization. Obviously, they're going to encounter barriers, their message is diluted within siloed systems. So when you have this type of operating system, openly sharing information between departments in order to assist employees and gain knowledge of the overall organization's mission, goals, objectives, it's very difficult, if not impossible. And culture plays a giant role in business success, for better or for worse. So, ask yourself, how healthy is our culture? When was the last time we did a culture analysis on our organization? It's an important question. It's also a very important key metric. So if you can kind of bring in that outsourced human capital executive, somebody that unbiased third set of eyes, you turn what this slide is into this slide. So now you have streamlined everything. You've eliminated that disparate approach and you've promoted a win-win between your internal systems, as well as like what we talked about is with each of your vendors and partners. So we talked a little bit about culture and think back to when was the last time, if ever, if you've done a culture analysis or a cultural survey within your organization. A healthier culture multiplies company growth and they enhance that company's resilience against not only crisis, but against the normal ups and downs of business life. The culture and health, it's just as a reliable predictor of success as sales figures. And so prioritizing that culture and employee happiness, it needs to start at the top to be successful. Leadership should be the driver of company values, setting and recognizing good examples of work. And it should be the first to address and fix issues when things take a wrong turn. So when you turn that operating system that we saw on the previous slide into one like we see here, you now improve employee engagement and productivity. You enforce a healthy culture and morale. And now you're reducing administrative burden, kind of going back to some of the very first slides that we saw, reducing the time you spend on non-revenue generating tasks. So we're making core economic areas more efficient. Revenue, customer satisfaction, quality, cost, cycle time, market capitalization, everything becomes more efficient. So this just kind of goes back to, the solution. So, being able to outsource for specific assessments, cultural assessment, again, is one. Project management, design, implementation. That outsourced human capital or healthcare executive, it can be, as creative as, what we talked about your benefits plan. We can be a short-term commitment. We've done projects that assess risk or assess culture, for example, in as little as a couple weeks. It can be long-term commitments. It can be something that is on, a monthly retainer type of situation, or it can be something where we're going in and doing an assessment and then managing a project, designing something and implementing it, and then turning it over to the internal resources. So by having that flexibility, this is very cost effective for employers. It goes back to employers, not being able to have the resources or the budget to bring in an in-house, healthcare or human capital or people or population. We've kind of heard it different, called different things, but an executive specific for that This is a very cost-effective solution for, smaller employers, even up to, 5,000, or even above, to again kind of have that third set of eyes and that transparency and control. And again, the unbiased opinions, the feedback, the absence of the politics that you're seeing, very beneficial to employers, owners, board members, upper level executives. And what's more is a person with this type of skill set, everything that they're bringing to the table, all of the solutions, they're backed by sound metrics and reporting. And again, it goes back to transparency and control. So we have no ulterior motive. An outsourced executive has no ulterior motive in, getting a bonus or getting a raise or playing this type of office politics or having you buy this particular health plan or this particular work comp strategy or this particular wellness program. Everything that we do is backed by sound metrics and reporting, so everything is completely transparent. We're providing you information, valuable intelligence in black and white, and then what you decide to do with that information is completely up to you. So, by doing that, by bringing these solutions to the table, the prediction, the intervention, backed by metrics and reporting, transparency, control, then you're assured quantified savings. And we talked again, we look at savings in different ways. It's not just about finance, but it's about saving and a return on investment in terms of, the human factor, the human capital factor. So the final few slides I put together, they're just some tips that are great to ensure that your internal systems are actually improving quality. When we look at healthcare strategies, they're not typically successful without strong leadership and cultural alignment. So what you want to do is you want to tee up leadership early in planning stages, and be prepared to provide coherent and impactful updates using meaningful data points. Your organizational culture is also an essential factor in the success or failure of a particular program, a culture program, a benefits program. The best programs make quality improvement a team sport. You want to set the bar high for success, make mistakes, learn from them, and then constantly pivot as new information is uncovered. And that's one of the things that we found with outsourced executives as well. They're oftentimes so much more flexible than what your internal systems can provide. So, I kind of asked, when was the last time you did a culture analysis or a culture survey? When was the last time you conducted an employee survey? Again, as to their understanding and happiness of benefits offered to them, or what they think of upper management or supervisory roles, or what they think of just, their workspace, their flex time. I mean, you name it. There are a lot of things that you can, gain in terms of knowledge and understanding from your workforce. When was the last time you surveyed or spoke to spouses? It's often them managing insurance, the health, the doctor's visits, the kids at home. It's often them accounting for a higher percentage of claims and the highest increase in claims the following year. So when we talk about leadership and culture, there are really 5 characteristics of a very strong workforce culture. It's the physical component, it's the psychological component, emotional, social, and financial. So if we can kind of, pick apart these 5 different characteristics and put features in place, small mini project assessments, surveys, project management implementations for each of these little 5 characteristics, then you're going to have a very strong leadership and workforce culture. The second tip is risk management and just having that type of mentality and that type of strategy. So quality improvement is about understanding your population's specific needs. Remember with that one slide when I told you, ask yourself, what am I trying to fix? What impact will this have on my population? What does success look like for us, as executives, for the employees? How will we know when we've achieved it? So again, success depends on applying those best practices to real world situations. The third, be proactive. Again, prevention and intervention. I know I've kind of drilled that in everybody's heads, but it's so much more powerful than just simply being reactionary. Identify opportunities for quality improvement. Use benchmark measures. Use them to your advantage. There's so many resources out there where you can use that. Identify which measures are falling below par and where you might have gaps in your data. By identifying these holes early and correcting them, you can improve your quality management strategy and then also ensure a smoother measure rate submission. These little successes, they lead to big sustainability measures. Employers that sustain and grow are the ones that excel and succeed. If you're not, as an employer, if you're not sustainable, what type of employees do you think you'll attract? If you're not sustainable, what do you think will happen to your fixed labor cost? Especially if the competition can sustain. So this affects everything. It affects salary, bonuses, growth, even jobs themselves. And the next tip is system optimization. So defined roles are essential. And again, what I just mentioned this, the best teams are flexible. So you want to find a communication platform or approach to share best practices, communication goals, discuss challenges, and develop action plans. The one slide where we talked about, streamlining the efficiency of an organization, you want to see that in an actual flow chart. It doesn't have to be sophisticated, but establish it, communicate its existence, and keep it up to date. Extend communication to frontline caregivers for insight into what is or what is not working. It's the day-to-day touches and the hand-holding that really deliver that customer service from consultants and outsourced executives, but then also, internally. Again, the true consumer, they like the simplicity, they like the customization, but they like the hand-holding. They like the educational component that comes with it. So very, very, very important to make sure that all the different pieces of your system, whether it's internal, external, third party, outsourced, vendor, you name it, everyone needs to work cohesively and collaboratively. One of the other tips is when we talk about healthcare, we talk about the 6 pillars of prevention. We see more and more wellness programs are failing these days. I think everything is going more towards a clinical approach, and part of that reason is because there are so many. I mean, you saw on the one side so many chronics out there, and so many chronics not receiving the recommended care, and so many gaps in care because they have multiple things wrong with them. So, the old traditional wellness programs just are not working. And then also too, the wellness vendors failed to provide a concrete return on investment to the employers. So when we talk about healthcare and when we talk about wellness and wellness programs and that being a benefit, which is something that millennials definitely want to see these days, we talk about the 6 pillars of prevention. So we're finding more and more that, you have your traditional medical component of prevention, but traditional and alternative is becoming very big these days. So there are some complementary alternative examples that I can kind of throw out there that where we can treat a workforce alternatively than traditional medical practices. Naturopathic medicine is very big. Medication, it's not always cheaper. And we're finding that study after study find major savings as a result of naturopathic care. You have reduced frequency of doctor visits, reduced cardiac risk, reduced cardiac episodes. There was a Blue Cross Blue Shield study that concluded that a naturopathic managed chronic disease program lowered the cost of chronic and stress-related illnesses by up to 40% and lowered cost of specialist utilization by 30%. So that's just one of the things that we're seeing. Therapeutic care. Private insurance, there was another study conducted that said that private insurers could recover as much as over $4.5 billion if they were to cover massage therapy nationally, as opposed to some of the riskier high force interventions that they currently cover. Chiropractic care. We're finding with chiropractic care lower amounts of back surgeries, lower hospitalization, lower MRIs. All in all, back pain episode related costs were 25% less with chiropractic coverage. And then we talk about, kind of caring for the whole. It's caring for body, mind, spirit, emotions. And that's why, we integrate all these different things into it. Physical and occupational therapy, something very important if your work comp costs or out of control. Fitness, obviously a big component, but nutrition and supplements, stress management and body work. When we do employee surveys, universally, it comes back, stress is the #1 health issue of both employers and employees. So if we can and we have set up wellness programs where stress management is just the #1 and sometimes even the only component of a wellness program. But then you have personal strategic coaching. So then it goes to, more of, finances and, just overall balancing that work life kind of, which can be very, very difficult. And finally, the last slide is employer-employee prosperity. So, you want to define a strong project plan, one that is aggressive, one's that detailed, but again, also flexible. And you want to recognize new insights that are gained, as you do these assessments, as you implement these new mini projects. Each report that you're getting from, whether or not it's from an internal executive or an outsourced executive, again, it's going to help you benchmark your results against established measures and provide you with a critical line of sight into your progress from whatever you do. You want to share this information with your team, your frontline providers, your leaders. It's very important, kind of going back to the leadership and the culture. We found that over 90% of employees overestimate their health. They think they're healthier than they actually are. So, if you take that statistic and those where it's, very difficult to drive true consumerism, then you have a recipe for very, very out of control healthcare cost. Employees also underestimate the employer's share of their benefit plan by more than half. So, they think that, their employer is paying, let's say, for example, $500 a month for their benefits. Their employer is paying, really $1,000 a month, per person for that benefit. So this disconnect equates to failure to see a need for action. And, as an employer, by being able to regain control of unmanageable healthcare costs, means helping employees become consumers of their own healthcare. And this results in savings across the board, not just for employees, but for the employer as well. And the final slide just shows my contact name and my contact information. That is my mobile number and my email address. Morrow Outsourcing is one of the associates that is in Elman Associates. We are a standalone outsource company. However, we do provide, like the one slide had mentioned, short-term to long-term outsourcing solutions, everything from, quick assessments and analysis to more long-term project management strategies. Provide very valuable insights and quantifiable savings to employers. So it would be it's very much appreciated that you took the time to look at this presentation today and to follow along. I would very much like to answer any questions. I know we haven't had any questions pop up on the chat, but please feel free to email me or call me anytime. There's no cost to just kind of, pick my brain a little bit, and I would love to learn more about your organization, what you do, what you have going on, maybe what some of your challenges are, and some of the things that we can do at Morrow Outsourcing to help you. So thank you.